Hello and welcome to the group room where we're at the 34th annual CTRC AACR San Antonio Breast Cancer Symposium. We are now joined by Professor Dr. Martine Piccart, who is the Director of Medicine at the Institut of Jules Bordet. She is Professor of Oncology at the Free University of Brussels and also the incoming President of the European Society of Medical Oncology, known as ESMO, and the Free University of Brussels, Professor Piccart in French is known as
L'Université Libre de Bruxelles.
Thank you. Welcome. I know how busy you are. And your work throughout Europe is so important. You are probably the most important breast cancer specialist in Europe that is now assuming leadership of ESMO, and I think it's terribly exciting, and also seeing a woman come in as president of ESMO is fantastic. And what I'd love to talk about with you are some of your plans for ESMO and also the impact meeting and what the goals and the purpose of that meeting is and the message that you want patients to hear. Patient advocacy in Europe is really growing, and patients are becoming far more informed and using their voices very differently than they have in the past, which also is probably changing some of the dynamics between the European physicians and how they're dealing with patients.
So as you can imagine, becoming president of ESMO is a huge responsibility. You only have 2 years to try to achieve something. So I have many things I would like to change, but I have to prioritize. And one of the things that is really upsetting me quite a bit is the inequalities in cancer outcome across Europe. And I really want, together with my colleagues of the ESMO board, to try to understand what we can do to change this. So the outcome of cancer patients in Eastern Europe are worse than the ones in Western Europe. So an organization like ESMO, I think, needs to examine what the reasons can be and then try to do something about that. And that will be the goal number one. The second worry I have is the fact that we are going to be short of medical oncologists in a decade. And we need to prepare for that. And I want to examine again with my colleagues what we could do to motivate doctors to go into medical oncology, and then also try to help medical oncologists coping with a very stressful profession, as well as the need to understand the biology of cancer, because multiple new drugs are coming, and if you don't understand the biology behind, it's really very difficult to be a very good doctor. So here also ESMO wants to develop new tools to help medical oncologists in the community, not only in academic hospitals, to do a better job for their patients.
These are not so dissimilar from the problems we have in the U.S. We're facing a shortage of physicians in medical oncology here. What do you attribute this to in Europe?
It's difficult to say, but I think that, of course, we have an aging population. So cancer becomes a huge problem, and we need to prepare for that. And I am not sure that politicians have been thinking about this. So we have to become very proactive, and we have to find some solutions so that we don't face a terrible situation in 10 to 15 years.
And also, when you look at Europe, each country, while people tend to think as Europe as one place in the sense of healthcare and the way healthcare is delivered, it's not so. And each country has its own policies and its own system where there's some similarities, but it's different throughout Europe. And then you have the addition of patients that are suddenly accessing information in new ways as patients in Europe are getting more information on their computers. And the pressure for the medical oncologist to also keep up with the demands of a newly informed cancer patient, that has to be a new challenge.
I fully agree with you. You know, we face a huge heterogeneity in Europe. And this can be also seen in the multiple guidelines we have across Europe. You know, it's not like in the United States. We have multiple guidelines, national guidelines, ESMO guidelines. So here also, I think that we will have to look into that, because patients travel, you know, they go from one country to the other, and they can be very disturbed by what they hear. You know, one doctor is going to talk about one treatment, another one will say that this is not at all the right treatment. So here also we have to try to do something. And ESMO has recently established a partnership with an organization that is going to try to provide optimal information to patients independently from the cancer they have. So, for example, explanations on why we do this or this treatment, and where they can find support, you know, really good information in a lay language, and that will help them and guide them as they struggle, you know, to get cured.
ASCO, the American Society for Clinical Oncology in the United States, and ESMO have very important collaborations happening. As you assume the presidency of ESMO, how do you foresee some of the evolving role that you would like to see happen between the two societies?
Well, you know, I've been fortunate to be a member of the ASCO board for 3 years. So I have been sitting there and understanding what are the problems medical oncologists and oncologists in general face in the United States. And I've been very impressed by, you know, the dynamism of ASCO and all the solutions they are currently trying to build to the problems. So because I have this experience, I think it's going to be easier for me to have a dialogue with them. And as a matter of fact, we face exactly the same problems. So I think we can do better things if we talk to one another. And the incoming president of ASCO is Sandra Swain, whom I know who is a breast cancer specialist. So I hope that we can really take an advantage of all this when we will be presidents together.
The responsibility of a medical oncologist today is very complex. Imagine if you are an older medical oncologist that wasn't trained in the way we understand the biology of cancer as we understand it today. How complex is it? It's not enough just to treat the patient. Now you have to understand the biology of cancer in a way that you never had to understand it. And I don't know how doctors keep up on all of this. For the younger generation, they're being trained differently. But when I think about the community-based oncologist here in the States that will see everything from, you know, all the spectrum of cancers, who's not specialized in one cancer, how is it possible to keep up on the volume of information, the speed at which this is changing, and understanding the molecular therapies that are available? It seems to me like an overwhelming task.
You are right, it's a big challenge, especially for some medical oncologists who are incredibly busy. You know, they are working with only one or two colleagues in very small hospitals. But here I think ESMO is really trying to help, and we recently acquired a fabulous program called OncoPro, which is a program you can access when you are an ESMO member. And it really gives you opportunities to get to know very quickly and easily what is happening in the field. So you can access summaries of meetings. You can access important information related to new drugs, discoveries in a user-friendly way. And so we think that this is a very great tool that we have developed for our members.
An area that also ESMO has been so instrumental in is palliative care. We've spent quite a bit of time with Professor Cherney. It's now a very important agenda here for ASCO, but ESMO has really done some fantastic outreach and education in the area of palliative care. I think Europe, there's less taboo about speaking of end of life, and death and mortality may be more easily integrated into the culture and the ability for society to talk about this very normal, difficult part of life, but you can't escape it. Will you talk to us a little bit about palliative care and the position that ESMO has, and also how medical oncologists deal with this difficult subject with patients in Europe?
You know, I think medical oncologists are there to accompany their patients until the very end. That's our role, and it's a very important role. And you are right, ESMO has been interested in the quality of palliative care for many, many years, and has also decided to acknowledge hospitals which are really doing a good job there. So we have designated centers for palliative care. They are audited, and then they received a kind of certificate. So just, you know, to make it very clear that we think that this is as important as trying to do a good job in early on in the disease. So the two aspects are equally important. And here also I think that the quality of management of patients who are very ill and for whom there is no cure possible is varying a lot from one place to the other. And there is a lot to do there in terms of providing very good guidelines, how to manage pain. You know, we think it's being done well. It's not true. So that's one of the priorities, indeed, of ESMO.
What is the biggest change that you're now observing amongst European cancer patients as you reflect on growing advocacy over the last decade?
I have seen dramatic changes. You know, patients now come to you, a lot of patients, not all of them, but a lot of patients come to you, and they have been looking around. They have been going on the internet, so they come with a series of questions, intelligent questions, and the dialogue that we have is a lot more interesting than it was 20 years ago. Now, in Europe still, there is a difference with US because I worked in the US for 2 years, and I think patients there are still very afraid to ask second opinion, to do something that would be viewed by their oncologist as something really not nice. So they are very scared. Many of them don't ask a second opinion. And that's something that we need to change because, you know, cancer is such a difficult disease to treat. So why wouldn't you ask opinions of different experts? There is nothing wrong about that. And that is a culture that we need to bring to Europe.
I'm very excited for the time I've spent with you, truly. I have had the pleasure of observing your work and seeing what you do over the last decade, and you're a very inspirational woman and doctor. Professor Dr. Martine Piccart, Professor of Oncology at the Free University of Brussels, the Director of Medicine at the Institut of Jules, Bordet, and the incoming President of the European Society of Medical Oncology, ESMO. Thank you very, very much, Professor Piccart.
Thank you.